Hello, future nurses. NurseEdScholar here. And today we are delving into the essential skill of conducting a health history. So this is going to be a brief review of how to observe the patient's general state of health while conducting a health history. All righty, so let's get started. So, you know, when we are observing the general health of a patient, we're going to be looking at body features and their characteristics. We're going to be noting any body movements, what's their posture, their level of consciousness. We're even going to be assessing the nutritional status of a patient, their speech, is it rapid speech, slow? Does it seem like the patient's just trying to find the words? Is pain causing the, I guess, inability of a patient to be able to uh, tell you what's going on with their condition? We need to also understand the patient's concerns. We're going to ask with the health history, the chief complaints, what's wrong with the patient? And then going into the history. How long has it been going on? When did it start? Where did it start? What were you doing when it started? And then as the patient is explaining it to you and you're receiving that subjective data, you want to try your best to document uh, the direct quotes of the client for clarity. And during this process, you're really trying to gain insights into the reason why the patient came to the hospital or the clinic or the office to seek care. So, understanding a patient's general um, physical state really provides that foundation. So let's move on to family history. So when you're exploring family health, we really want to ask the patient the health status of any direct blood relatives, parents, siblings, and even the spouse. Reason being for the spouse, maybe if the spouse is ill, are they ill because of an environmental condition? Are they ill because they smoke? Because, if the spouse is a smoker, maybe your condition could be due to secondhand smoke. So it's always, really asking who else is in the household. Um, Also, during this process, obtaining family history, you're going to see if there are any genetic factors that could be influencing the patient's current health condition. Lifestyle factors, does the patient, drink alcohol? Do they use drugs? Do they, is there any tobacco use? You also want to ask about sexual practices, any tattoos or body piercings, because those bring their own risk of health conditions. You want to gather any information about travel history. Have they gone out the country lately? Work settings. Where do they work? Do they work in any kind of factory or some kind of plant, chemical plant? Because with that information, you're going to identify any occupational hazards that could be causing the patient's health condition. And also, when you're doing a family and social history, you want to address any sensitive issues. And with that, that would be obtaining a domestic violence screening. And, doing this is determining whether the client has experienced domestic abuse or domestic violence. And this can be a male or female. Um, It's more known for females, but men are also experience domestic violence as well. This screening will be conducted during your one-on-one interview, and you really want to make sure that the client knows that they are safe and this is a confidential environment. So just kind of, bringing it all together, when you conducting a health history, you want to know the general health of the patient, observing the patient. You want to know their chief complaint, what's the family and social history, how are they impacting the patient's health, um, and understanding the importance of this really uh, creates an environment of effective care. So it's very important to conduct a thorough health history and encourage that open communication, that therapeutic communication for accurate information, because the information that you gather and obtain is going to determine your plan of care. So that concludes our journey today with that brief history, uh, brief, brief explanation of how to do a health history assessment. Remember that these skills are core for your nursing practice. I thank you for your dedication for learning. And if you like, comment, subscribe if you found this video helpful in any kind of way, just kind of clarifying things for you. And until next time, happy nursing.